primordial follicles during prenatal development of females. Primordial germ cells called ogona is divided by mitosis to produce more ogona in the fetal ovaries. They develop into what we call primary ogonas into primary oocytes. Each primary oocyte is surrounded by a layer of flattened epithelial cells called follicular cells, forming a primordial follicle. So in early fetal development, these primary oocytes begin to process meiosis, but the process soon stops and does not start again until puberty. Once these primordial follicles are produced during the fetal development, no new ones are produced. So that's important to remember. So you get your primordial follicles in the fetal stage and they're not produced afterwards. Now, these last two bullets you need to know. The number of oocytes continually decline as almost 90% of these primordial follicles are present at birth, and apoptosis is like the cell just dies. Okay, you ever seen an infant when it's born? The webbing of the fingers has dry, dead skin. That's called apoptosis. Okay, and so it's programmed cell death between birth and early adulthood. Now, you have fewer than 300 to 400 oocytes are released from the ovary during the female productive's life. So this is, you have these oocytes continually decline. 90% are present at birth, then are lost to apoptosis. And for your notes, I wrote there's 250,000 to 500,000 primordial follicles present at birth, okay? So somewhere, that's a lot. 250,000 to 500,000 of these primordial follicles are present at birth, but they go into a programmed death where 90% is lost to have only about 300 to 400 of these oocytes are released from the ovary during the female's productive life. I don't have a lot of explanation for it, why it happens, but 90% at birth are declining, and by puberty there's only 300 to 400 oocytes. But know that. So let's talk about the internal accessory reproductive organs. Those are the uterine tubes, and again you can say fallopian tubes, they're the same. The uterus and the vagina. Okay? So the uterine tube is about 10 centimeters long. Another word is oviducts, but you'll either hear me say uterine tubes or fallopian tubes. It's a tubular organ that transports the ovulated egg cell from the ovary to the uterus. See if we've got, and here you can see that up on the screen. Both sides have a uterine tube. Okay, and then you should, you can see that, and then on the one on the left is actually holding the ovary, and it's suspended by ligaments. It's held. Okay, so the infundibulum is in near the ovary is the funnel-like infundibulum. Let me see. Trying to see if it's on the screen. Yeah. So this would be kind of how it opens up. And it's, pulled away from the ovary. And this would be the fimbriae, right? Which holds on. So they say it's kind of like a funnel-like. And so the infundibulum though and the fimbriae are really together, okay? It's just the infundibulum is the funnel opening, and then the fimbriae are the little finger-looking things that actually hold the ovary. The fimbriae lies close to the ovary, so they pick up the ovulated egg cell. You have inner mucosa, and remember that is mucus cells, middle muscularis, the outer coverings of the peritoneum. Mucosis is lined with cilia. Anytime you have mucus, you're going to have cilia, those little arms that help aid in movement of mucosis or mucus. And with this mucus, it helps transport the egg down the uterine tube. The peristaltic contractions help move the secondary oocytes down the uterine tube. We'll talk a little bit about these contractions that help aid in movement. And then fertilization occurs, class, make sure you know this, in the uterine tube. And so the the ovary to be fertilized has to move into the tube. And the way that it moves is these contractions called peristaltic contractions. It's almost like peristaltic means it's like a wave movement. And we have that when we swallow our food, kind of the same way. I want you to know for your notes, mucois is lined with cilia, which aids in the transport of the egg and down the uterine tube. I want you to know that the movement is called peristaltic contractions. I also want you to know that if a female gets ovarian cancer, it starts in the fimbriae. Just like we talked about prostate cancer for men, it starts in the prostate gland. Both are deadly. Both are deadly. Takes a lot of lives. Take a look at the right cilia on mucous cells. And remember, these types are epithelium cells, but the mucous cells have the green cilia that you can see. And again, it's just aiding in movement. All right, the uterus. So, as you all know, the uterus is separated by the cervix, which is the opening of the uterus, okay? And then, of course, the vagina. So the cervix is the starting of the uterus, and then there is a uterine tube. And so the uterus then is somewhere around 7 centimeters long by 5 centimeters wide. That's a non-pregnant uterus. It's pregnant, it's much bigger. The uterus receives the embryo and sustains its development. I want you to underline that. What does that mean, sustains its development? Basically, from an egg cell fertilized in the uterine tube and sustaining development of the fetus. That's what that means. So sustains its development. It starts from the egg, once it's fertilized, it's a living cell. Inside of that uterine tube, sustaining development of the fetus, which then is inside of the uterus. So regions of the uterus, all right? You have a body, and you have, which is the fundus, has a fundus at the top. You can see what the fundus is. That takes it to the, it's not labeled, but it does take it to the uterine tube. That would be the fundus. And then the cervix is this neck-looking lower section, which is about 1/3 partially extends into the upper part of the vagina. You have 3 layers of the wall of the uterus. We've talked about the mucosa, which is the endometrium. The myometrium is the muscle layer, and the serosa is the parametrium. Okay, so just so if we're talking about the uterus having the endometrium, this section right here would be where the mucosa cells are, okay? Aid in with those little green cilia. The myometrium would be this is all muscle. You see that on both sides? Muscle. And then the parametrium is this serosa, and it's this more of this outer layer. So you have 3 different layers. And it's, just remember, parametrium's outer, myometrium's the inner muscle, and endometrium is the where the mucus is. And the mucus is going to be on the inside. Right? Just like in our stomachs we have mucus, in our esophagus, the inside we have mucus. Inside the cervix and vagina there are going to be mucous cells. Alright. So, what I want you to know here, I want you to know definitely the second, let's go back. Second, receives the embryo and sustains its development. Know what I mentioned about from the fertilized egg in the uterine tube to the development of the fetus. And then I want you to know the layers of the uterine wall and be able to describe those layers to me. The vagina is fibromuscular tube that runs between the uterus and the outside of the body. It conveys the uterine secretions, receives the penis during intercourse, and provides a passageway for the offspring during birth. It surrounds the end of the cervix. And you can see the vagina here and how it surrounds the end of the cervix. And so it does quite a few things there. I want you to know that it conveys, underline, it conveys uterine secretions, receives the penis during intercourse, and provides a passageway for the offspring during birth. So there's 3 different things that it does, and then it cervix. The vaginal orifice is partially enclosed by a hymen, a thin layer of connective tissue, and stratified squamous epithelium. The walls of the vagina has also 3 layers. The intermucosal layer, if you can just remember, this is where the stratus squamous epithelium, just like the roof of your mouth. Very similar. How flattened that is. There is also an intermucosal layer and an outer fibrous layer. All right, so a little thing on preventing cervical cancer. Advises women from 21 to age 30 to test every 3 years. And after 34, 3 to 5 years, it says 21 to 30. And after 30, what your doctor said. Vaccination. You know, it's something is vaccination is where HPV vaccinations are occurring regularly. You know, it wasn't available when I was your all's age. The fastest growing population of HPV is your all's age. The bad thing about it, it can cause cancer to women in their 40s. It's a bad situation. So the vaccinations are out there. You all are still at the age that you can get the vaccination. They try to give it to, I think, children in their adolescent years, like 12, 13. Is it controversial? I don't think it is. I think it was when it first came out. But that's something between parents and you all being adults now and going to soon be parents. You'll make that decision. At one time, there are, even though HPV is not alive, they have identified 40 different species of non-living viruses. 40 of HPVs. Pretty scary. 40 that they've identified. All right. Female external reproductive organs. So we're going to talk about the outside, okay? The proper name is vulva, you know? How often do you hear that word? Not very often, right? Yeah, you hear another word for it, but vulva is the proper pronunciation. You have the labia majora, the labia minora, the clitoris, and the vestibule. Okay, so in the you can actually see, we're not gynecologists here, but you can get a good up front look here. Notice that the labium majus or majoris, they're calling it majus, but that's just the name, but majoris. And then the labium minoris. The majora is rounded folds of adipose tissue and skin. So these rounded folds encloses and protects the outer external reproductive organs. Then you have, so this area, and then this lip-like action is the minoris. And then the opening on the inside is the vestibular gland, which is the opening to the vagina. All right. So you all can go through those and read, but make sure you understand and have those have that down. The clitoris is the little apparatus at the top, and this little apparatus is very similar to how the penis works on a man. It's stimulated, it erects, but it's got two different parts to it: corpora cavernosa and corpora spongosa. So it has two parts. The cavernosa is the part that erects up during stimulation. The spongosa is the root of the clitoris. There's a very small gland there supplied with a nerve fiber for sensory action. That's what causes the orgasm. So during stimulation at the base, then the cavernosa will erect up, much like a penis will. So I was reading, do you really know what the clitoris helps in? Of course, it is part of orgasm, but you know why that's for? Any thoughts? Yeah, it's pleasurable, but you know what it's for? It's to help keep sperm in rhythm to swim towards the fallopian tube to fertilize the egg. Because the sperm doesn't really know what it's doing once it gets in the vagina. And so and that's why orgasm can be achieved multiple times. Interesting, isn't it? I was reading this in my book, it's in your book, and like I said, I learn something all the time. But it's actually to help the sperm stay in rhythm, to help find the vagina. So let's talk about the vestibular gland. It secretes mucus into the vestibule during sexual stimulation. So this whole gland helps keep the vagina lubricated. All right, so I got something for you guys. So I want you to know about the clitoris and that it corresponds to the male penis. I want you to know corpora cavernosa, corpora spongosa. But sexual stimulation from the clitoris impulses the spinal cord, releases vasodilator nitric oxide. Just like in the man, nitric oxide is released to increase blood flow. Tissue swells, the vagina expands, mucus secretion continues. So the clitoris impulses the spinal cord. So it's as it starts to erect, the vasodilator, so this is the blood, okay, squeezing on the artery, releases nitric oxide to increase blood flow to swell the vagina and expand mucus secretions. So erection tissues in the clitoris are around the vaginal entrance. I only talked about that, the two different parts. Nitric oxide dilates the arteries and the erectile tissue, expanding the vagina. Lubrication then occurs by these vestibular glands. I want you to know that's where lubrication comes from. Mucus then lubricates the vestibule and the vagina to aid in intercourse. Orgasm responds to sexual stimulation. Sexual stimulation ends with orgasm, pleasurable feeling of psychological and physiological release. Muscles of the perineum, the uterus, and the uterine tubes contract rhythmically, which helps transport sperm towards the uterine tube. Well, there it even talks about it. So that very thing that I just mentioned, I didn't realize it was in this PowerPoint, that it does that rhythmic movement to aid sperm to get into the uterine tube. All right, the erection, lubrication, sexual stimulation, you guys can read through that. Pretty much we've already gone over it. The there you go. Functions of the female reproductive organs. We've gone through each one. You can read through those again. Theogenesis is a process of maturation of an oocyte. Beginning at puberty, some primary oocytes continue meiosis 1, resulting in cells having half as many chromosomes as in the parent cell. Remember, half as many means 23. The male has 20, sperm has 23, and the oocytes have 23. When primary oocytes divide, cytoplasm is distributed unequally, forming a large secondary oocyte in a small first polar body. This is very different from spermatogenesis in the male, in which cytoplasm is divided equally. You have what we call a secondary oocyte, is their future egg cell, which may be fertilized by sperm in the future. The secondary oocyte undergoes meiosis 2 if it is fertilized. So keep that in mind. So if it's fertilized in meiosis 2, that's when you get the 2 more daughter cells to make it 4. Okay? If it's fertilized, so one of those is fertilized out of those 4. The polar bodies allows for the formation of an egg cell with large amounts of cytoplasm and organelles and a haploid number of chromosomes. Polar bodies degenerate 15 hours after fertilization. Okay? They degenerate. Polar bodies' main function, production of an egg cell to carry the zygote through the first few cell divisions. And remember, once that cell is fertilized, it has to go through cell divisions. Okay? And that's what polar bodies do. You can just put polar bodies carry the zygote through the first few cell divisions. So underline secondary oocyte, and secondary oocyte means it goes through meiosis 2, which tells us, class, that the egg is fertilized. Okay? It's that 23 chromosomes are fertilized So that egg now has 46 when it's fertilized, because sperm fertilized that egg, right? So if there's a second ovum class, it means that that egg now is a fertilized egg, and it's a 46 chromosomes that will then start going through meiosis and what we call polar bodies then go through this process. They degenerate after fertilization. But the whole point of polar body is to carry the fertilized egg, and it goes through cell division. This is all part of oogenesis. And this would be an example of a secondary oocyte and the first polar body. Follicle maturation. At puberty, anterior pituitary gland secretes greater amounts of SSH, and the ovaries enlarge in response. This is at puberty. During reproductive years, some primordial follicles mature in the primary follicles. Primary oocyte enlarges. The single layer of follicular cells is first converted with plasmas to cuboidal cells. This layer then proliferates into several layers of granulosa cells. There are several zones of this. We have zona pellucida, which is a glycoprotein layer formed between the oocyte and the granulosa cells. I'm really not going to, you guys can go through this and read how the egg then becomes fertilized. We call this follicle maturation. Ovaries contain these primordial follicles and the stages in development. So then you have ovulation. So I guess I'll read through it real fast. So at puberty, in response to hormonal stimulation, primordial follicles begin maturing into the primary follicles. Number 2, down at the bottom there, says it takes 2 or 3 months for the primary follicles to reach the pre-antral stage. It takes another 70 additional days for pre-antral follicles to reach the size of 0.2 millimeters. In another 65 to 70 days, the pre-antral follicle will have become the antral follicle. Number 4, the antral follicle will grow quite rapidly and mature in about 15 days prior to ovulation. So ovulation, the remnants of the antral follicle becomes the corpus luteum. If fertilization of the ovulated secondary oocyte does not occur, the corpus luteum degenerates to become the corpus albicans. Do you need to know all that? No. What I want you to know, if the secondary oocyte occurs, the fertilization is most likely. But these antral follicles, they degenerate once that happens, okay? All right, any questions? All right, thank you for not asking questions. 'Cause I don't know if I know the answer. This actually is more in depth than my last, they got into it more. So follicle maturation, during early follicle maturation, when the primary oocyte enlarges, granulosa cells proliferate by mitosis. It may take 150 days for the primordial follicles to become secondary follicles. So you can read through all this and just remember, you know, how this works. Do you need to know the exact dates and all of that, what takes place for follicular maturation, no, you don't need to, because I don't know it. You don't need to know the zones, and just remember the primary follicles may begin maturing. It takes about 300 days for these primordial follicles to develop and mature. The continuous process of follicle development in the ovaries so that there is new mature anterior follicles ready for ovulation. Then the menstrual cycle. So let's talk about ovulation. That's a little more interesting. Okay. When a woman goes or ovulates. So ovulation means it's close to the end of the follicle maturation. Your primary oocyte undergoes meiosis I, producing a secondary oocyte and the first polar body. The process of ovulation releases the secondary oocyte and the first polar body from mature anterior follicles. Ovulation is triggered by the surge of LH, luteinizing hormone. Remember that? That is part of the release of the anterior pituitary gland. It's released. The walls of the follicle swell, weaken, and ruptures. The secondary oocyte and one or two layers of surrounding follicular cells are usually propelled to the opening of the nearby uterine tube by the fimbriae. So now, during the second oocyte, it must be fertilized within hours because it's going to degenerate. So again, I want you to know ovulation, for your notes, is triggered by the surge of LH released from the anterior pituitary gland. That's a test question for sure. Okay? When that happens, your secondary oocytes surrounding the follicular cells are usually propelled to the opening of the nearby uterine tube by the fimbriae. The oocyte must be fertilized during this secondary oocyte. And if it's not fertilized, then it's going to degenerate and pregnancy is not going to occur. Does that make sense? With ovulation and the secondary oocyte, okay?
Ovulation egg drop.
And here it kind of gives you that review from microscopy. All right, so female sex hormones. They're secreted by the hypothalamus, the anterior pituitary gland, and the ovaries control the following reproductive process. Development and maintenance of female secondary sex characteristics, which are specialized features associated with the adult female body. Maturation of female sex cells, changes during menstrual cycles. So here are what you need to know. Gonadotropin is a releasing hormone, GnRH, secreted by the hypothalamus, causing the anterior pituitary to secrete FSH and LH, which is very important for female sex hormones. So this GnRH actually comes from the hypothalamus down the pituitary stalk to the anterior pituitary gland to say, okay, I need you to manufacture both FSH and LH to control oocyte maturation and the production of female sex hormone. For the test, I want you to know what gonadotropin comes from the hypothalamus to just tell the anterior pituitary to put out two hormones. This is a process of ovulation, okay? These two hormones that the anterior pituitary gland manufactures or synthesizes is LH and FSH. You need to know that. So the last two. So now estrogen, which we're all familiar with, and progesterone are secreted by the ovaries. Okay? So that means FSH and LH are secreted into the bloodstream, then to send the message down to tell the ovaries to secrete estrogen and progesterone. So estrogen stimulates the enlargement of accessory reproductive organs. So it's going to stimulate the enlargement, stimulates the thickening of the endometrium, develop and maintains female secondary sex characteristics, breast and your mammary gland ducts development, increase adipose tissue in breast, thighs, and buttocks, increase vascularization of the skin. That's all that estrogen does, you know. So you're going through puberty, and therefore the body develops for a lady, from a girl to a woman, basically. Progesterone stimulates the uterine changes during menstrual cycles. It affects your mammary gland, regulates secretion of gonadotropin. So kind of know what the difference between estrogen. Estrogen's all in the development from puberty. But it also enlarges the reproductive organs, which is the development of puberty. Progesterone then aids, stimulates during changes in menstrual cycles. It affects the mammary glands. So this would be milk production. I'm sure you all know when maybe a menstrual cycle is coming, the breasts start to hurt. That's progesterone. There's a reason for that. And then you might know that it's coming soon when that all triggers, right? And then it regulates the secretion of gonadotropins, which I found interesting. So androgens are secreted by the adrenal cortex. It causes growth of pubic and auxiliary hair at puberty. So then now you know androgen gives your pubic hair. Okay. This, we can go through all this again, but I'm not going to bore you with this. But notice how the hormones work. Hormones always travel by way of bloodstream, but the hypothalamus releases GnRH to get things going. Then you have both FSH and LH that have their own that they're the hormones that get in the bloodstream, and then they affect the ovaries. The ovaries release estrogen and progesterone for reasons that we discussed. And just walk yourself through this with your notes, and it should make a lot of sense to you when you study. So the menstrual cycle class. it ends the reproduction cycle. So there's two cycles. There's basically the menstrual cycle or the reproduction cycle, okay? It's characterized by regular recurring changes in the endometrium of the uterus, which culminates in the menstrual bleeding. This begins around the age of 13 and continues into the early 50s. Got something for you. 85% of women by age 52 stop their menstrual cycle. Put that in your notes. Usually 52. So can a woman still get pregnant all the way up to age 50? Strong possibility. Depends on how physically fit she is. That aids a lot into that. I don't know, y'all know who Nancy Grace is? That talk show lady's always talking about murders and things, going after the criminals. She had twins at like 52, something like that.
My grandma did that. My aunt and uncle are 14.
What's that?
My aunt and uncle are 14. My mom's in her 40s. Her siblings are like 30 years younger than her.
Oh, really?
Yeah.
In the oldest, let's see, how was it? It was in the Guinness Book of World Record. The oldest man to father a child was 96. His sperm was, and the woman was in her 50s, and they were from India. He's long gone by now. I've known this for about 10 years now, but I'm sure he's gone. So when does the first reproductive cycle usually happen? Puberty. The average age is around 13. I don't know. That might be your all's average age. I don't know when it happened. I don't know. Don't need to know. Personal question, but put that down as average, okay? And it's, women tend to mature earlier than men, but yet physical development might take longer, you know, you've always heard about that. So anyways, I won't move on. Each month, regular reoccurring changes also occur in the ovary. As one mature antral follicle is ovulated and the remnants of the follicle close up to become the corpus luteum. In the absence of fertilization, the oocyte degenerates and then the corpus luteum also degenerates, becoming the corpus albicans. Remember, I'm not gonna make you know all that. Remember, menarche is the first reproductive cycle. That's puberty. When the menstrual cycle starts, the end of reproduction cycle happens. The menstrual cycle is bleeding. Phases of the menstrual cycle. So I'm just gonna kind of hit on things that I want you to know. There's three phases. There's what we call the ovarian phase and the uterine phase, okay? ovulation happens in the ovarian phase, and the menstrual phase happens in the uterine phase. If you will, keep that in your notes, okay? And then you can look and see in the uterine phase, the endometrium is thickening under the direction of estrogen. The endometrium becomes more vascular under the direction of progesterone. Uterine tube produces nutrients and possible plantation of fertilized eggs. The menstrual phase is endometrial lining slough off on degeneration. Corpus luteum, menstrual bleeding removes the slough tissue. So menstrual bleeding is there basically to clean out and slough off the endometrial linings. And this is what they call degeneration of the corpus luteum. Hormone control, we've already gone through that. I'm not gonna read that again. You guys can read it just when you go to study. Major events of the menstrual cycle. Now we're talking. Let's see what we got here. That's page 80, 179, 80. Okay, so if the number 6 down there, if the secondary oocyte is not fertilized, the corpus luteum degenerates and no longer secretes estrogen and progesterone. As the concentration of the hormones from the corpus luteum decline, blood vessels in the endometrium constrict. The uterine lining disintegrates and sloughs off the producing menstrual flow. The anterior pituitary gland is no longer inhibited and again secretes FSH and LH. The menstrual cycle repeats. So 6 down through 10 is when that secondary oocyte does not fertilize, okay? Then the menstrual cycle will begin to basically blood flow to clean up and flow out any of the, they call it slough off. And it basically flows out the uterine lining. It disintegrates and sloughs off. That's the terminology, okay? This menstrual cycle will continue to repeat if the reproductive cycle doesn't take in the secondary oocyte. If that makes sense, we'll move on. Here it talks about the events of the menstrual cycle. You have ovarian activity. They're good in the days. The menstrual phase. You have, if they do it in the period of, you have 1 to 5 days of the menstrual cycle process, and then the reproductive cycle is in 28 days, if I'm understanding that correctly. So you have a menstrual phase or prolific phase, a secretory phase, back to a menstrual phase. And then it uses the estrogen and progesterone to work. So, yeah. Feels like I need to brush up on all this, so. All right, good stuff, infertility. The inability to conceive a child after 1 year of trying, know that, infertility. Males and females contribute equally to infertility. 25% of cases due to more than one factor, according to the American Society of Reproductive Medicine. All right. Some female infertility class. Anovulation is hypersecretion of SSH and LH from the anterior pituitary and resulting in lack of ovulation. So hyposecretion, okay? Endometriosis. Endometrial tissue grows in abnormal cavity. Fibrosis occurs, which may encase ovary or obstruct uterine tubes. So, I kid you not, there was a girl at work, at my work, she had endometriosis. She couldn't get pregnant. And her and her husband, they tried and just gave up. She went and got on this shot to lose weight because of her blood sugar levels, right? They were high. And I forget which one it was. She's pregnant within the first month of taking it. And they said, so something keeps that from blocking. Somehow, there's a block in endometriosis, there's a blocking that occurs to obstruct the uterine tubes from the ovary getting fertilized. She didn't know exactly what was happening. She was taking medication and all that, but she's pregnant after a month of that shot. So you ever heard that?
That happened to my sister.
So obviously, I mean, the shot's kind of scary. It really is. It's kind of scary because everybody's taking it now. Yeah, they're losing weight, but I don't know. But then infections such as gonorrhea, which can obstruct uterine tubes, and gonorrhea
I think she
is
was
a sexually
taking a shot after she
transmitted
just wanted to hide or
bacteria
something.
because of production
Some kind of medicine.
basically mucus that prevents sperm from entering the uterine tube. So evidently, the mucus is very thick, and that's what causes gonorrhea. It doesn't cause gonorrhea, excuse me. But gonorrhea causes the mucus to be very thick, and the sperm can't penetrate the uterine tube. Causes, I don't know, really. Menopause. We talked about menopause after the age of 52. Most women are in menopause. The stopping of the menstrual cycles for 1 year would be considered menopause. Usually occurs in the late 40s or early 50s. Ovaries no longer produce as much estrogen and progesterone as they did previously. Some female secondary sex characteristics may disappear. Increased loss of bone matrix, osteoporosis starts to occur. 50% of women experience hot flashes, migraine headaches, back aches, fatigue occur in some women. Has your mother's experienced any of this? Have they hit that age yet? My sister went through this. She had headaches so bad that she finally, at 54, she had to quit her job. And now she has congestive heart failure because she laid in the bed for so long that she has this issue. because of the migraines. But please know menopause, late 40s, early 50s, 50% of women, symptoms, hot flashes, headaches, backaches, fatigue, and so enjoy your life, ladies. Your mammary glands, talk about those. They're accessory organs of the female reproductive system. They specialize in secrete milk following pregnancy to nourish the baby. It's located in your subcutaneous tissues of the interior thorax within the breast. Nipples of each breast is surrounded by a circular area of pigmented skin called the areola. The structure of the mammary glands is composed of 15 to 20 irregularly shaped lobes. I want you to know that. That's your ducts, your lactiferous ducts that lead to the nipple and open to the outside of the body. Each lobe contains alveolar glands drained by alveolar ducts. Development of breast mammary glands of males and females are similar. As puberty is reached, the ovarian hormones stimulate the development of mammary glands in females. And you can see the alveolar duct and the lactiferous ducts. The lactiferous ducts class is what exit to the outside of the body, and that's where the milk will come out of the pregnant woman. Breast cancer. Areas of thickened tissues or dimples, changing in contour of nipples that flatten or point in an abnormal direction. Nipple discharge. All these things are signs that something's not right. Okay? Biopsies can confirm whether cancer is present or suspicious tissue. So always, keep that in mind. A lumpectomy is what removes a mass. They call that a simple. Surgical treatments include lumpectomy, simple mastectomy, and radical mastectomy. So I can tell you about my sister. My sister, my dad's side of the family, have genetic breast cancer. Okay, so my sister, in her late 30s, early 40s, she ended up having a lumpectomy. Something wasn't right. But she then went through the process of the cancer treatment, and that cancer treatment that they were giving her was to shrink the mass. So she went through all of this, and it was a type of cancer treatment that they give to you to shrink masses. And so then after they went to do a lumpectomy, and when they got in there, they got it out and realized that she had cancer had spread. And so then they went ahead and just removed her breast. So she went through a pretty traumatic thing, because she went through all this chemo treatment to shrink her, the mass in one of the breasts. Then when she gets in there and they go to remove it, they found out that it had spread through the lymph node to the other breast. And so she ended up having them removed, but she could have had that done to start with. Now, insurance companies are looking at that and paying off on mastectomies, where they, because they save so much, they reconstruct the breast, and, but then after that, they put her through radiation. It was a bad situation for her. She's still cancer-free today, but she went through all that, and she probably could have just had both breasts removed. You can't just remove one. You know, in the old days, they did that to women. And, it's sad, you know? Took that from them. But surgical treatments, so radiation, chemotherapy, newer drugs keep signals, estrogen and growth factors from stimulating cancer cells to divide. Self-exams and mammograms are helpful in finding breast cancer. Genetic testing, know your genetics, know your family's history. Both parents, my mother's side, which my sisters, none of them have breast cancer. But on my dad's side, he lost his sister to breast cancer, and he had 3 sisters, all had breast cancer. They're survivors still today, but one was lost. So they all ended up getting it. Maybe not all, but I know 2 or 3 out of 4 sisters. 5 to 10% of breast cancers arise from inherited tendencies. This says 5 to 10. I think it's much higher, but your book says 5 to 10. Genetic testing. Does it say what age? I think in your 30s definitely. But knowing the warning signs. Birth control, voluntary regulation of the number of offspring produced at the time they are conceived. Contraception is a method which can avoid fertilization following sexual intercourse or prevent implantation. There are several methods of contraception, widely varying degrees of effectiveness. Coitus interrupts practice of withdrawing the penis from the vagina before ejaculation prevention. Entry to sperm cells in the female reproductive tract. Not very effective. Since sperm can leave the urethra before ejaculation. Did you hear that? So, a penis may not even be hard. And sperm is in the penis. Rhythm method requires abstinence from sexual intercourse 2 days before and 1 day after ovulation. Again, not very effective in trying to figure out the rhythm method. Mechanical barriers prevent sperm from entering the female tract during sexual intercourse. Male and female condoms. Sponge, you've heard of that. Spermicides in the form of creams and foams and jellies. Most effective when used with a mechanical barrier. You know you're going to have a sex education class this year. IUDs. Okay? They're small, solid objects implanted in the uterine cavity. Causes inflammation. That is toxic to sperm and oocytes. Prevents pregnancies. A lot of women do that today. Or a man gets a vasectomy. Now I explained what a vasectomy was. Hormone contraceptives prevents maturation and release of the secondary oocyte. But I want you to know IUDs. Know the mechanical barriers and chemical barriers. Know what's not as effective. Coitus and rhythm. They're not so effective. And here you can see the sponge in B, birth control pills, female and male condoms in A, vasectomy, I told you about that, that's in the ductus deferens class, know that. Tubal litigation, uterine tubes are cut and ends are tied that prevent sperm from reaching the oocyte. So they go in and they snip the uterine tube. And so that is how a woman can get hurt herself fixed. And so women do that. Sterilization, surgical procedures that permanently prevent pregnancy. That would be vasectomy and tubal litigation. Another word, tubes tied. You ever heard that? You gotta get my tubes. That's what that is. Tubal litigation. The morning after pill can be taken 3 to 5 days after intercourse. Works by temporarily stopping ovulation. Prevents pregnancy but does not work if ovulation has already occurred. You can look at this ductus deferens, how they do that. Here they're showing cuts going up, not all the way up at the top. And then you see in B, snips being made through the ovarian tube. Okay, birth control methods, symptoms of STIs, burning sensation during urination. So STDs are now called STIs. Okay? So STDs was my day, now STIs. STI, they're termed STIs. So if you have burning sensation in your urine, that's always a good sign there's something. Your pain in your lower abdomen, fewer swollen glands in the neck, pain, sores, blisters, bumps, and rashes are always a sign. You can have both a viral STI or a bacterial STI. They both can be treated, but remember, bacterial can be killed, viral can just be controlled, so dormant. They talk about AIDS. AIDS is something that is transmitted through semen, blood, milk, causes deterioration of the body's immune defenses at sea. Hepatitis C and HIV are two of the deadliest transmitted diseases by way of entering the bloodstream, and they're both viruses, but they now are just about curable. Okay, but unfortunately, you might not know. So I want you to know some infections. HIV is viral. Okay. Chlamydia is the most common sexual disease, which you get yearning, a smell in your urine. It's a bacterial. Genital herpes, genital warts, they're both viral. HPV. I said gonorrhea was a bacterial. So gonorrhea and chlamydia, bacterial. HIV, genital herpes, genital warts are all viral. Gonorrhea, syphilis, bacteria. Trichomonas, bacteria. So when you talk about bacteria, how do they enter? They enter also by semen, bloodstream, same way that a virus enters. Remember, bacteria is living cells. They're their own cell. And then a virus disguises itself inside of the host cell, which is living. All right, that's it. We finished this one up. Um, all right, so next week we'll do 23, and then we're gonna have an exam. So I know we're getting close to I should be done today with 23, but anyways, got a slow start. Class, so, we're gonna we can do one or two things. Since the rest of the students aren't here, I could waive the quiz. And we could have it next week on the blood, if you guys would like, since I didn't get to 23. And then the other girls would be here. Would you rather do that?
I won't be here next week.
You won't be here next week, so we'll go ahead and do it then. So, alright. Okay, so next week we'll finish 23, but then there'll be a test. So,
Yeah.
Okay. Alright, so you guys wanna just take a little time and study a little bit before we go over the